Heroin opioids addiction. Oh my. Hi, my name is Allie Bishop, and I am a social work intern for the Family Advocacy Program at the Defense Logistics Agency Installation Operations Management in Susquehanna and New Cumberland, Pennsylvania. I have created this webinar about the effects of opioid addiction on families. However, before you think this presentation has nothing to do with you, think about the people around you who may be affected. Maybe it hasn't touched your immediate family, but what about your friends, neighbors, coworkers, and community? Addiction doesn't exist in a bubble. Everyone around you knows or loves someone that is an addict. There are several myths associated with addiction and those who are addicted. Myth number 1. Addicts can stop if they truly desire. This is false. Long-term substance abuse changes the chemistry in the brain. This can cause cravings, withdrawal symptoms, and impulse control problems. Myth number 2. Addiction only affects those who are weak, uneducated, or have low morals. This is false. Addiction can occur in anyone, regardless of age, occupation, or socioeconomic background. Myth number 3. Addicts who relapse are hopeless. This is false. Addiction is a chronic, relapsing disease. Relapsing does not mean the person has failed. In fact, processing the events surrounding a relapse can help prevent future relapses. Myth number 4. Only drug and alcohol use causes addiction. This is false. Though they can cause addiction, there are also several factors that contribute to addiction that include genetic predisposition, environment, and mental health. However, there are people who can use drugs and/or alcohol and never become addicted. Now that we have discussed the myths of addiction, let's discuss what is true about opioids. Opioids damage families, schools, workplaces, communities, and ultimately the whole country. Abuse of opiates is a health problem and safety problem and costing society billions of dollars a year. Just to refresh, there are two major types of opiates, heroin and certain prescription drugs. Both affect the brain and body and are highly addictive. Opioids are an epidemic. Opioid addiction is not a moral failing. Rather, it is a disease. Opioids, whether prescribed or illegal, can change a person's brain chemistry and create dependency. Signs that someone may have become addicted to an opiate include failing to cut down on use despite knowing the consequences, not fulfilling major life responsibilities such as family and work as a result of addiction, showing less interest in activities he or she used to enjoy, physical symptoms such as fatigue, confusion, impaired coordination, slow reflexes, constricted pupils, and feeling breathless, seeking opiates through other means when unable to get a prescription, and needing to take more and more to get the same effect. Who's affected? Everyone's affected, not just users. Families, including husbands, wives, children, grandparents, friends, neighbors, and co-workers. From children to the elderly population, from college students to veterans. Children can be affected in multiple ways. If their parents were addicted, they have a higher risk of becoming addicted. Additionally, children can access and use their parents' prescription drugs they can find in the cabinets without their parents' consent. Children can also be affected even without using the drugs themselves. They can lose important parent bonding time, or even worse, be neglected by their parents. The elderly population is also part of the statistics. Many can find heroin and fentanyl effective pain relievers if they lack access to prescription medication. College students are another group affected. Many college students may abuse opioids to sedate anxiety or may even find themselves pressured in situations such as parties. Another group affected are veterans. Veterans are often prescribed opioids to soothe post-combat injuries. Furthermore, opioid addiction may cause family members to need kinship care. If parents are affected by addiction, this can in turn impact their employment, health, and finances, ultimately affecting their family, especially if the users have children. Furthermore, expecting mothers who are addicted to opioids can pass the addiction to their unborn children. Consequently, babies are born with the symptoms of opioid withdrawal. This is known as neonatal abstinence syndrome, or also known as NAS. NAS is a combination of complications that occur in a newborn who is exposed to addictive opiate drugs while in a mother's womb. Withdrawal symptoms can occur during the prenatal or postnatal stage depending on when the drugs are discontinued from the infant's system. If NAS is present, medical personnel are aware to look for tremors, seizures, and excessive crying. Specific drugs may cause learning disabilities, birth defects, or ongoing seizure disorders or other medical problems. There are many costs of addiction other than just expenses. Finances, relationships, emotions, physicality, and spirituality are all affected by addiction. The financial costs of addiction. Having to replace stolen items can be expensive. Driving accidents, medical bills, and/or missed work can become costly as a result of a loved one's addiction. Other financial costs include travel costs, missed work, and/or unpaid late bills. The relationship costs of addiction. Addiction can cause loss of friends, discord with family members, estrangement, isolation, neglect, loss of trust, loss of intimacy, and humiliation. The emotional cost of addiction. Addiction can cause anger, embarrassment, resentment, guilt, depression, anxiety, dread, and anhedonia. This means that you don't take pleasure in the things you used to. The physical cost of addiction. Addiction can cause insomnia, stress, health issues, mental health crises, malnutrition, and weight gain or loss. The spiritual cost of addiction. Addiction can also cause loss of dignity, change in goals, loss of self or faith, disconnection, and loneliness. So actual costs. The annual societal cost of addiction in the United States is $223 billion. Criminal justice costs are $71 billion. In 2012, the U.S. federal government enacted drug control spending of $26.3 billion, with more than 51%, that is around $13.5 billion, for domestic law enforcement and prohibition of illegal drug use, according to the article, Dynamics in the Cost of Criminality Among Opioid-Dependent Individuals. Furthermore, spending on addiction and substance use consumes about 10% of the federal budget and 16% of state budgets. The annual cost of drug-related crime is more than $61 billion. Here are just a few statistics I have included. Pennsylvania has the fastest growing rate of drug overdoses in the nation. Within a 12-month period ending in July of 2017, there were 5,443 deaths as a result of overdosing. This was a 43.4% increase compared to the previous 12 months. The Prescription Drug Monitoring Program, also known as PDMP, allows prescribers and pharmacists to look up their patients' controlled substance prescription histories to prevent clients from doctor shopping and pharmacy hopping. Before PDMP, clients could go to different doctors requesting pain medication. With PDMP, prescribers now have access to an electronic database that collects information regarding what controlled substances were dispensed, how much, to whom, and by whom. PDMP has been implemented in 17 states to reduce overprescribing opioids to clients. Approximately 97,000 prescribers and pharmacists have registered. Here are just a couple of resources I've included if you would like to utilize, including national hotlines and crisis lines. The references listed here are websites that I utilized and cited throughout this webinar. In conclusion, as I have said throughout the presentation, addiction affects everyone. Therefore, I encourage you to have intentional conversations with friends and family members and help support one another, whether it be addiction or other challenges in your loved ones' lives.